As the oldest and only daughter of my siblings, I've grown up with my mom. We've gone through a lot of tough times together, but she always made an effort to ensure that I wasn't aware of any of those troubles. My childhood was great, but we had moved around a lot. In kindergarten, I stayed with my grandparents in Coyote Canyon. I never knew why until a couple years later when my mom had told me that she had moved to Phoenix, Arizona to try to start a better life for us. I know it was rough for her, but I only know this because I've gotten older. I was oblivious to it when I was younger. However, something that I did become aware of on my own was the financial burdens we were going through. Of course, I never understood her troubles, but I picked up on her visible distress at the kitchen table looking at her bills. One of the issues I noticed very early was we used to only have fast food for years. Pizza was one of the main meals we'd eat because it was cheap enough to feed 5 people at once. I now can't eat pizza without getting nauseous. This also includes many other fast food places that make me feel sick. I know my parents and brothers want a home cooked meal just as much as I do. I started to recognize myself as a financial burden to them. I've gained a subconscious awareness of financial burden and I became a frugal spender, so much to the point that when I spent a lot of money, my family has asked if someone had stolen my card. Even with how tight money is, my parents have always given the best gifts during birthdays, Christmases, whatever it may be. They try their hardest, and I want them to know that I recognize their efforts and am beyond grateful to them. I've dedicated myself to helping my parents. I've looked into jobs and how soon I could get one so I can help them with whatever they needed. I learned how to take care of my brothers and taught myself how to clean. I try to stay out of trouble and keep my grades up to ensure that they don't need to worry about me too. I want to take a little weight off their shoulders knowing that I'm old enough to help them now too. And when I accomplish all that I've needed to, I want to promise my parents that I'll give them the life that they deserve and have worked so hard for.
Hello, my name is Cherie Ashley Toledo. I am the mother of Chasity. As a teen mom, everything is very stressful, everything is very new, everything is very complicated. I did struggle from the very beginning, finding out that I was pregnant at 16, not of age to have my own insurance, let alone just insurance for myself, which is more than likely under my parents. It did cause a lot of confusion. So I did start reaching out to different programs. I did go through the WIC program, which did help a lot with food and formula. It was a lot of research on my end. I would Google a lot of things. I would try to figure out things for myself. Having to have somebody look down on you just because you are so young and you're carrying a child with you, and asking for help, asking for resources, that did hinder me from getting help. From what I remember, it did add to the mental health of side of things. Trying to co-parent, trying to make it to where everything is 50-50. All that weight on one parent does weigh on you. There's a lot of things that I would change if I could go back. Just from my experience, it was a tough road.
As stated before, my mom used different programs to help her financially, and one of those programs she mentioned was WIC. So, what is WIC? WIC stands for Women, Infant, and Children. In 1972, WIC was created as a supplemental food program for low-income and nutrition-risk mothers and children up to age 5. By 1974, WIC was operating in 45 states. They now operate in all 50 states, including 31 Indian tribal organizations such as the Navajo Nation, Laguna, Acoma, the Cherokee Nation, and the Pueblo of Zuni. They provide parenting advice, breastfeeding support, food assistance, referrals to childcare and healthcare programs, and many more. Some foods they provide are milk, instant formula, baby foods, yogurt, eggs, juice, etc. Similarly to WIC, SNAP is also a major food assistance program. The Supplemental Nutrition Assistance Program, also known as SNAP, provides financial assistance to low-income families to help them pay for food. SNAP became official in 1964 with the passing of the Food Stamp Act. Families now get an electronic benefits transfer card, which gives you money every month to pay for nutritional foods. To be eligible, it's based on the family's income and how many people are in the household.
My name is Penny Nez. I work with the Presbyterian Medical Services here in Farmington. I am a PD determiner there. So what I do is when a patient comes into our facility and don't have any insurance, I will sit down with them. But if I don't catch them, I'll call them and see if I could schedule an appointment with them to see if I could get them on one of the grants we have available. There are a lot of grants available that they can apply. They should, at least get a good amount to continue their education. So if you are eligible, you can get Medicaid. For the younger people that are finishing high school, when they're going to be on Medicaid, they can either still be with their family until they're the age of 25, or if they did move out, they can also apply on their own. It does still go by income on that one. If they don't qualify, then they do get sent to an agency called Be Well New Mexico that have agents there that are able to help them look for no cost or low cost insurance for them. I do work with a grant called the Healthcare Authority Grant, which is the San Juan County Indigent Fund Grant. The income on that one is a little bit more than Medicaid. So a lot of people do qualify for that. All Native Americans, we get them on the IHS contract, and so they could come to our facility and get services for free depending on where their addresses are. I don't think getting Medicaid or help with paying for medical visits is embarrassing.
Medicaid was part of the Social Security Act that was chaptered in 1935. It's a state and federal health insurance coverage program that caters to low-income families, children in foster care, and those with disabilities. Each state has their own Medicaid program, but the federal government has rules each state must follow. The name for New Mexico's Medicaid program is called Turquoise Care, beginning in 2024. It is a managed care organization that will have you choose out of 4 healthcare plans to receive Medicaid benefits and additional services. The 4 plans include Blue Cross Blue Shield Plan, Molina Healthcare Plan, Presbyterian Plan, and the United Healthcare Community Plan. Turquoise Care covers pregnancy, prenatal care, and postpartum care. For help with both Medicaid and SNAP, yes.nm.gov is the website to go to. You can visit the site to apply for these benefits as well as TANF and LIHEAP. TANF is cash assistance that provides a monthly cash benefit to needy families with a maximum of $447 per month or $5,400 a year. The Low-Income Home Energy Assistance Program helps low-income families with heating and cooling costs, energy bills, weatherization, and low-cost home energy equipment repairs and replacements. CHIP is the Children's Health Insurance Program that was established in 1997. It's insurance for children and families that make too much income for Medicaid but not enough to afford health care. CHIP covers routine checkups, immunizations, doctor visits, prescriptions, laboratory and x-ray services, and more. While child services and dental visits are free, some states will charge monthly premiums, and for some services there will be a copayment. There is no application deadline for both Medicaid and CHIP. You just apply, and if you're eligible, coverage starts immediately. If you're still having trouble finding insurance, Be Well is New Mexico's health insurance marketplace. Marketplaces were created by Patient Protection and the ACA. What's the ACA? The Affordable Care Act, also known as Obamacare, was chaptered in 2010. It was created to improve healthcare quality, health insurance coverage, and healthcare cost. Be Well helps residents learn more about health insurance, compare plans, enroll with different plans, and qualify for subsidies to help reduce the cost of insurance. To be eligible, you must be a resident of New Mexico, be uninsured, and not qualify for Medicaid.
Hi, my name is Francella Manzanares, and I'm a teacher. First 4 years was ninth grade seminar, and then now I'm the past teacher. My history goes back, all the way to the 80s. And then in the 90s, I got interviewed for a night school for teenage moms, and it was called the Alternative High School, actually. And it was specifically for girls that had children or that had gotten pregnant. We opened up a day program, and it was called the Alternative Basic Studies. We renamed it the Learning Center. All the alternative school closed down, and this program for teenage parents called the Learning Center became part of the vocational technical school here in Santa Fe. We renamed it again to the Teen Parent Center. I go to administration, I go and I visit other high schools throughout New Mexico that have on-site daycare centers, and lo and behold, we opened a daycare center. The first week that the New Mexican ran a story that we were going to have a daycare center for teenage parents at the VOTEC, we got over 50 girls calling if they could come back to school. And all we had was room for 5 babies. It's just, I threw myself totally into helping them. I guess maybe being a young mother myself at the time, I saw that it was something that was really needed. There's just so many components that make it so much more difficult for you as a young mom and being in high school. It takes a lot of people to support them. And there was a lot of support with each other. When you have all teen moms, like the Teen Parent Center, it's just kind of neat because they all supported each other. If they embellish that support, they'll succeed. But if they don't embellish it, and they kind of not refuse it, but they don't embrace it, they won't succeed. With the help and accepting the help, you can move on and graduate and even beyond. Some alternative form of getting your education. They need it. It's so critical. And you're doing it for you and your child, you know. Too young to do this alone. You need help. My young moms, they were joyful, you know, and some sad, but they're really special. They were very special to me.
Established in 1989, the GRADS program has 25 locations statewide that encourages teen parents to finish high school and gain parental knowledge. They provide funding for licensed child care centers to be on site. They also embedded 10 areas of research that parents should know, such as processing skills, parenting skills, and economic independence. The Teen Parent Program provides any young parent with parenting skills, graduation motivation, and self-advocacy skills. They operate in Santa Fe Public Schools, Santa Fe High School, Capitol High School, Academy, Engage, and Santa Fe Community College. They work with the GRADS program by using 1 class period per day with their curriculum. They give case management support, home visits, and they have a fully staffed Head Start at SFHS and CHS. Next is the Los Alamos National Laboratory, founded in 1997. Their mission is to promote social and racial equity while supporting the youth and families in a culturally respectful manner. They provide programs such as the Early Childhood Program, the K-12 program, College, Career, and Community Pathways, and the Inquiry Science Education Consortium. Fortunately, I had the honor to work with both the Teen Parent Program and the Lano Foundation to create change in the community. I reached out to both Francella and the Teen Parent Program, where I was able to learn lots about teen parent resources. Francella and I decided to reach out to the Lano Foundation. Francella, Amber Tenorio, the Lano Foundation, and I collaborated to create a teen parent workshop taking place on April 5th from 9 a.m. to 5 p.m. We include gift baskets for mom and baby, breakfast and lunch, and a $200 stipend to young parents from ages 16 to 24. Our goal is to engage these parents in activities that create motivation for the future, identify values, share strengths, and more.